So one of the hardest things to do nowadays in medical billing is to figure out patient's responsibility. In today's video, I'm going to try my best to give you the most tips that I can to help you figure out how to determine patient's responsibility. If you're interested in seeing that video, then please keep watching. Hi guys, Tamika here. Welcome or welcome back. We're going to be trying to determine patient's responsibility in today's video. We're going to jump right in it. It's going to be a quick video, but I hope it'll give you some information that you can use to determine patient's responsibility. Now, to start off, what exactly is patient responsibility? If you are in medical billing or if you just have insurance in general, this is something that you should know. So patient responsibility is what you owe when you go to a doctor's office, a hospital, a laboratory, any type of medical office or facility. You may have a patient responsibility. Now, there are some policies where you won't have that. But as a patient and as a medical biller, you need to know if the patient has a patient responsibility. What does patient responsibility include? It includes your copay, your coinsurance, and your deductible. I will go into what these mean and maybe some examples in a next video, but just so that you know, those are the three items where you have something to pay, or the patient may have something to pay if their policy includes these items. Nowadays, most policies do include these items, but you can't just jump to conclusions and believe that all of them do. Some policies don't have any copays. Some policies even pay 100%. But most of the time when you have a policy that pays 100%, you're usually paying a high premium, or the patient is usually paying a high premium, because the higher your premium, the better your benefits for the most part. But it just depends on what you need and what you use when you're trying to determine what you want for your policy. So we're not going to get into all of that. That might be another video as well. But those are the three items that's included in patient responsibility. Now, what should you do as a medical biller to be as accurate as possible when figuring out patient responsibility? You should first always call the insurance company. Right now, like I said, I say call because that's how I do it for the most part. I can also look for that information online, but not everybody has that capability of going online. Even though with all the technology and the new stuff and online this and online that, you either can call the insurance company or they have sometimes eligibility that you can do online where you can check that information out online. But either way, you just need to find out from the insurance company what each patient's policy includes. If they have a copay, a coinsurance, and a deductible, how much they have met of that deductible, what is the copay for a primary physician, a specialist, a laboratory, for the ER. It just depends on where that patient is going. So in an example, if the patient is going to a OBGYN, then they would probably be known as a specialist. I have known some providers who are OBGYNs who are not considered specialists for particular insurances, but that's a whole nother thing too. But let's say they're a specialist and their specialist copay is $60, but their primary's copay is $30. So just to show you that they have a range, or sometimes have different copays for different specialties. And then you have maybe your coinsurance, so that might be a 80-20, a 60-40, where 40 being the patient's responsibility, 60 being the insurance responsibility, 20 being the patient's responsibility, 80 being the insurance responsibility. There's so many ways that it can go, so you just need to call from the insurance company and figure out what each patient's policy includes as far as benefits. Now, you're trying to be as accurate as possible, but when you speak to the patients after calling the insurance company, you need to always let them know that this is just an approximation. You never know what the insurance is going to pay until they actually pay it. So for Example, if a patient has been coming to your office for 5 years now, they have the same policy, they have the same copay, and every time they come, they pay $50 copay. You just never know if one of those times, after all of that time, their policy has changed, the insurance company processes the claim differently, and instead of having a $50 copay, they have a $70 copay. Like, you, even though this patient has been coming to you for I don't know how long, you still need to make sure you let them know this is just an approximation. What I usually try to tell patients is, this is your copay. Today's visit is going to be $30. We'll bill the insurance, and if there's a balance, then we'll send you a bill. They would usually say, okay, no problem. Or if they might question, well, why would there be more? I would just always say to them that it's not a guarantee of coverage. They say that it's $30, but it's only until we bill the insurance is when we're sure that that is what the copay is. Always let them know that it's approximation. Always use the word estimate or approximation. How do you guarantee that you give the patient the correct amount and so that you wouldn't have to send them a bill after? If I knew that answer, I would definitely tell you. But there's no way to guarantee anything when it comes to insurance companies. You can try your best to be as accurate as you can, but you definitely cannot guarantee anybody that the insurance company is going to pay a specific amount. Again, like I said before in the other question, you always let them know it's an approximation and there's no guarantee. You have to wait until you bill the insurance company, and then you'll be able to tell them the exact amount that they owe. When it comes to sending out bills, you try your best not to have to send out bills. As a biller, sending out bills takes up time, it takes up money, but you try your best not to have to do that. But there'll definitely be a time when you have to do it. You might think that you're as accurate as you possibly could, and you're sure that you're not going to have to do it, but you never know. You might be incorrect, you might be off a couple dollars, and you may have to send out bills. Keep in mind that you probably may have to send out statements every month regardless. It might not be a lot, but you're gonna have to send out patient statements. So let me tell you a few of my examples during these years that I have been doing medical billing. When I first started off in 2006, it was pretty easy to determine the patient's responsibility. Let's give Medicare as one of the examples, and I'm going to give Cigna as the other example. For Medicare, you have a deductible, which may be, let's say, $100. It started off pretty low, and now it's up to like $200 and something. But you have a deductible. The patient has to meet the deductible before Medicare pays anything. After they have met the deductible, then they pay 20%, and the insurance, which is Medicare, pays 80%. Pretty simple, right? No big tra-la-la. Now, as far as Medicare, they're pretty much the same. Now it's the same thing. They have a deductible, and then they have a co-insurance, which is $20.80. As far as Cigna, back then it was a copay. You had a copay. Let's say you went to a doctor's office. If it was a primary physician, a specialist, whoever, you went to the office, you had a copay. Let's say the copay was $30. I do believe it was a difference between the primary and a specialty physician, and you had two different copays, but they weren't a lot. They were maybe like $20, $25, and maybe $30, but it wasn't a whole lot. So you pay a copay, $20, $25, and then the insurance company pays the rest. As far as like other insurances, they pretty much had the same thing, whether it was a deductible, a co-insurance, a copay, but it was probably one or the other. It wasn't like a mixture of things. Back in the day, again, for let's say Cigna, you might have had a copay for the office visit, but then if you had anything done in a hospital or a facility setting, you may have had a co-insurance, or you may have had a co-payment, but it was a big co-payment. So it was maybe something like, if you had a surgery, you had a $500 co-payment, and then the insurance company paid the rest. Something to that extent. but it was pretty simple. Nowadays, however, it is so difficult to determine what the patient owes. Up until maybe yesterday, I had a patient who had a Cigna plan, and the patient had a copayment of $30. They had a coinsurance of 20%. They had a deductible of $200, which they didn't meet, and they had an out-of-pocket of, I think it was like $5,000 or $7,000 or something like that. The patient had an office visit, and so I would have charged them their copay for an office visit. They didn't have a procedure, they didn't have anything done, it was just a regular office visit. We charged the patient the copay of $30, we billed the insurance, and then when it came back, they had the patient owing $38. So I was confused and I wanted to know why. I called the insurance company and they explained to me that this patient's policy is a copayment and a coinsurance with a regular office visit. Now, this was the first time it ever happened to me. I've never seen that before, so I really had to question the representative. If you do billing or if you know anything about it, you know that these representatives sometimes have no idea what they're talking about. That's another video I'm probably going to do because I need to rant about that. But the people that they hire in these insurance companies to be the representatives, a lot of them just don't know what they're doing. I've always wanted to work on the other side, on the insurance side of this whole thing, to just see how it works and what they do, but haven't been able to do that yet. However, like I said, I questioned the representative trying to figure out what's going on. How can she have a co-payment and a co-insurance for just an office visit? But that's what they said she had, so that's what I had to end up telling the patient, and they did owe a little bit more. I think it was like $8 more, which wasn't a lot. But if it was something that was a lot, then it probably would have been a problem, because they would have been questioning, and oh, my copay is this and why that, and I would have to tell them to call the insurance company. But that's one of the examples. Then we have other examples where a patient may come into the office, they have a copay and they have a coinsurance and they have a deductible. And so if the patient has a visit in the office plus a procedure, they have to pay a certain amount to their office visit, which is the copayment usually, and then they have to pay a percentage, which is their coinsurance, for the procedure. I started to get used to that because there are certain insurances who do that. Now, for me, the insurances that we have here in the Virgin Islands and the policies that the patients usually have, if it's United Healthcare, that's one of them, or not most, but maybe some of the United Healthcares usually make the patient pay a copay for the visit and then a coinsurance for any procedures, whether it's in office or in the facility, in a hospital or anything like that. So you might have a copay and a coinsurance. Then you have the examples where the patient has no copay. They might have a coinsurance and then a deductible. And so anything that they have done first goes to their deductible, just like with Medicare, and then the insurance company pays 80-20, 70-30, whatever it is. So it's just so many different scenarios. And I hope I can probably do some other videos where maybe I can actually show you some examples with numbers and figures and stuff like that. But I hope this kind of helped a little bit. It's really hard to give you a science, an exact science to how to determine patient responsibility. If anything that you learn from this video, it would be to make sure you never tell the patient that this is a guarantee. This is what you owe and this is guaranteed, because it's never that. You just need to let them know that it's an approximation and that this is what we'll take now, but if there's a balance, we will send you a bill. So that's the end of this video. If you have any questions, please leave them below. I make videos on Saturdays. So if you like things like this, videos like this, please like this video, subscribe, and comment below. And I hope to see you in the next one.